Hello everyone, I'm Dr. Nachiket Bhatia, sitting beside Dr. Akhil Baby, rank 8, May AIIMS 2017. A very warm congratulations, Dr. Baby.
Thank you, sir.
He is such a great survivor, I can't even tell you. A big struggler, the man who can defeat any odds. He was rank 807 in November AIIMS and now rank 8. A jump of 799 positions. I mean, how is that even possible? I mean, just within 6 months, how can such a person do such an impossible feat? We will hear right now from the words Dr. Baby.
Hi everyone. I'm from AIIMS New Delhi. I started studying for PG from my internship, start of internship. We had 3 months of village posting, so I couldn't do much in the 3 months of the start of my internship. And I started properly from April 2016. I tried to correlate with the T&D topics, the classes were there. So I tried to finish at least half of the portions before the class. But most of the time it didn't happen. But still, I tried to come for the class, and after the class, 1 to 2 days, the rest of the topics I tried to finish, and I started the next topic for the next week. Most of the time, I couldn't stick to the timetable, but still, I tried to manage to attend almost all of the classes. But I couldn't attend 2 to 3 classes due to some reason. But almost all of the classes I attended TND, and the TND was the core preparation strategy for me. My main focus was to finish the first and second professional subjects first, so that the final subjects were almost fresh for everybody. The rank deciding was the first and second year subjects. So I tried to finish that first. Especially for AIIMS, I just did the AIIMS previous year. I tried to finish 5-year questions, but I couldn't. I almost finished previous 3-year AIIMS questions. Along with that, TNT notes I studied, and for individual subjects, I studied the books which I studied in my MBBS course only. And for final year subjects, I studied some review books also. After reading that, I attended the TNT class and the TNT in my November, but I couldn't finish everything in November, so my rank was 807. I wouldn't be getting anything at that time, so I tried to go on with my preparations, and for May 2017. And after November, my main strategy was to finish in first 1 month or 1 to 2 months the topics I had left out. So to finish that topics first. My weakest subject was surgery, because I didn't study surgery in my final prof that well. So I took almost 1 month, December 1 month, I tried to study surgery, but that was a big mistake that I regret a lot of the time during my preparation, because I wasted 1 month. उतना तो नहीं waste करना चाहिए था. I attended TND classes surgery, which was very nice. Actually, that was enough, but to my self-confidence, to boost my confidence, I studied surgery for 1 month. After that, in the January, I studied the rest of the topics that I left out during my internship. And from March onwards, I started revising and doing previous year questions. I will also give in between subject-wise tests and grand tests. The subject-wise test, we could after completing every subject, if we give subject-wise test, it give us a boost. If however we stand and how we should improve ourselves, and the examiner type of perspective and questions, how they are asking. Even if we study the subject, we may not be focusing on some points, how they will be asking us, how they will be asked as a question. So giving tests are very important. Then
See, actually, I want you to emphasize the importance of revising. The trend these days is extra long classes, and people don't tend to revise. I always say that the classes should be crisp. An institute is supposed to be a filter. It is supposed to filter the unnecessary knowledge and provide you the basic important points, so that at the time of revision you have less to learn, less to keep in your mind, and more confidence. People these days are having notes. I mean, you studied in DBMCI TNT. How did you like the notes over there?
The main key role that stands behind the success is self-study and self-revision only. Even if we attend lots of classes, but if we couldn't revise at the last 1 month, it's of no use. So the advantage of TND is that if we have a pretty good base, if you have studied something in the MBBS, if you have managed to get a 60% above in MBBS, TND will be enough for the preparation. So because we had TND only once a week, one subject, and some subjects 3 weeks. So it's almost, we could cover at least half of the subject in the time of the TND period, along with internship. My strategy was to finish the left out topics in first 2 months and give the rest of the months for revision and previous year questions. So revision is very important. At least 2 to 3 times revision is must. At least for like subjects like anesthesia, forensic and all, 3 times revision is a must. Otherwise, it's equal to not studying if you don't revise. For subjects like medicine, pediatrics, obs-gynae, your final year studies plus internship TND is enough. But for volatile subjects like anatomy, anesthesia, forensic, microbiology, etc., you need to revise 2 to 3 times.
2 to 3 times. See, Dr. Baby, right now you are being presented as a mentor to all the members of Team DBMCI. Seriously, I mean, they can learn so much from you, and you can help a person who can actually have a rank of 20. You know, with your tips, maybe he can, if he learns properly, he can get into top 10. You know, a person who is right now into the 50s, he can get into the top 20s. This is the kind of stuff a mentor can help you with. Anything that you would like to tell your mentees over there?
My preparation for phase was like, I was a bit tense type of a person. So I used to call my home every day and talk like 15-20 minutes. I was having other frustrations, ups and downs, everything was there. But everybody should have a timetable. At least if there is not a written timetable, something should be having in your mind. I will finish this much topics in this time, then I will go to this subject in next time. So at least some structure should be there. What you are going to do in the next 4 to 5 months. My advice is to for the last 1 week you should plan 1 month before. My problem was for last day and last 2 days I didn't know what to read, so it was hell tense time. The last 1 day I didn't study anything. I couldn't study anything because lots of things. There were lots of things to revise. I don't know what to read, what to study. So I just read the forensic, some IPC, etc., some chapters and anesthesia. But you should have in your mind for the last 2 to 3 days what you should read. At least that you should keep in mind. And the last 3 days revision, that should be only focused for the highly volatile subjects. For other subjects, the last 3 days revision won't make much difference, because what you have studied in the previous 5-6 months, that will help you in the exam. For like subjects like medicine, pediatrics, obs-gynae, surgery, etc., no need to revise in the last 1 week. It's of not much use. But for other subjects like forensic, anesthesia, etc., you should that topics you should keep for last 3 days.
And tell me, since the topic is up, how important are the image-based questions these days?
Lots of image-based questions are coming this time also. Almost around 50, above 50 questions were image-based. The problem is that if we know the image, we can directly answer. But if we don't know the image, then also we can answer by knowing in almost every question there will be some clinical history will be there. So my advice is to always see through the images while preparing. Just browse through the internet, and if possible, just download and keep it in a folder for separate subjects. But it's impossible. It's not possible to. We don't know which image is important, what is important. So while reading PATH, you can either read PATH textbook, but it won't be possible for internship. So any guidebook or TND book, plus you can see the images and ropings. But don't just go through the images, and it's not need to mug up the images. Just see what is in that. In the renal images, the GI images and cardiac images are the most important ones. How to differentiate in renal, every time there's a question being asked on nephropathies. So just 3-4 nephropathies images are given in the ropings. Just try to differentiate how if the picture comes in exam, how to differentiate and how to answer. Just that sort of thing we have to learn. Not just mugging up the images, उससे कुछ फायदा नहीं होगा. obviously they won't be putting the same image from the textbook. They may be taking from a Google image, but still we could differentiate based on the history, obviously. But also, if we see the image, we should be able to differentiate. But it's possible actually if we just read the 2-3 lines given below the image, we could actually differentiate the images.
So you attended DBMCI Vibe last year, am I right?
Yes, sir.
How was it helpful to you?
Last year, my portion was not that enough to capture all everything that was told in the class. But still, I tried and understood almost 50-60% at least. I could understand what they're saying. The Vibe class was actually very nice. If I attended the Vibe this time, it would have been much beneficial. But the Vibe class was very nice. If you could manage to attend that one, it will be a boost for the preparation. Plus, self-learning is also much important because the teachers can't say everything in such a short span of time. So you could take that as an example, and like for other topics that they're not covering, so we can go by like that by that only, like searching for each and every image while we are studying or preparing. Just browse to the internet, so we could get at least if we see once, we may remember. That may count in the exam.
See, actually, making the use of AIIMS may, I came to know that even images were there from physiology. So this time DBMs has actually planned something really that's pretty new. See, DBMCI is now going to provide 19 subject images. That's a pretty unique feature of ours, right? But that's not all. 19 subjects which will be going to be clubbed with Predict Your NEET, Predict Your AIIMS, where the most probable topics of AIIMS and NEET will be discussed over there. So the student has, more to focus on these topics. Most probably, we will be clubbing this with an image-based CLTS. That's a exam-based atmosphere, exam-based software, and that is going to be live on your computer. 200 images, that's all. So now you can actually cover up all your image-based, the portion of your exam strategy there and then. Within 10 days, you will be thorough. So what do you think about this?
Yeah, if we get a pre-exposure before the exam, it will be like stress buster. Because for most of the images that in this exam I was seeing for the first time, ophthalmology images, I haven't seen that. So if we could at least see similar images before, we could at least think like we could at least exclude one option at least. So it would be a great.
See, I personally believe there's always an exam fear and exam anxiety, and that too in front of a computer. You are, always thorough with the pen and paper, but in front of the computer, if the last minute choking happens, your whole year goes waste. So DBMCI actually thought, why not prepare our students from the very first minute?
Yeah, I think that would be a great initiative.
And DBMCI has another product that's called CLTS, Champion Live Test Series, where we have 13 exams, all on computer-based tests, and that too all over country. So you can do 6 NEET-based exams, 2 AIIMS-based, 2 JIPMER-based, and we have also a PGI that is also based on the computer itself, and 1 image-based. So that when you go to your NEET or your AIIMS, that is just like a 14th CLTS for you. You are exam anxiety-free. Exactly. What's the ultimate aim? The ultimate aim is to clear that exam. Ultimate aim is not to revise and remember all the teachings, just to clear the exam. See, these are the kind of stuff which I think that can actually help a student go from 0 to 100 in less than 2 days. I believe so. Also, what about Facebook Premier Group? DBMCI Facebook Premier Group. You are a part of that, right?
I was a member of the Facebook Premier Group. But I didn't use Facebook much in my initial time of preparations because first 3 months we were in village, and after that I started studying, and then but the last time when I was in library, every 10 minutes I used to log into Facebook. So these groups are very useful. At least
you can see the thoughts of every country, every student in the country.
After 30 minutes of study, after 30 minutes you can just log into Facebook and you can see that questions will be there. You can just.
I believe so. These groups are very important because you can see the thoughts and the mindset of every student in the country. For the people who don't know, DBMCI Facebook Premier Group is just exclusive for DBMCI people. DBMC students, you can post a question over there and your query will be answered by the premier faculty of DBMCI within 2 hours. Plus, you will get to see thousands of students posting their answers. You will see how right you are. That's like a test analysis amongst itself. So, I would also like you to tell students that, see, you attended our TND. I think that's the only course you completed, right? Among all the coaching institutes you joined, TND was the only course that you focused on thoroughly and completed, right? So, with TND, what else did you do? See, this is a non-commercial part where I really want you to tell students that, okay, I'm a topper. I thought this in this manner. My mindset was this. How?
Actually, my thinking was to club the TN. No, I didn't make a timetable in my internship, so I thought like I will go with the TNB. So initial subjects were first year, second year subjects only. So I thought I will go with the TND. So I studied the subjects 2 to 3 days before TND. I tried to finish at least that I could complete. Then I came for the TND, and the rest, the topics which were discussed in the TND were all like concept-based things. There were also online questions, but the faculty knew like what all things the students won't be knowing. So they tried to complete all those topics, and then I went back and read those topics. But the faculty can't complete the entire subject in 5 hours or 4 hours. So you need to put some extra effort also. Previous year questions, there's some topics which will be left out by the faculty, we need to find it out. So my strategy was to do like that only, like move with the TND and complete my course in August or mid-September, and then revise in last 1.5 months.
I think that's a pretty good approach. And any certain faculty in DBMCI you would like to thank?
Yeah, the first one is surgery faculty. The surgery 3 days, 3 weeks class, 3 classes which was very high yielding classes. Because in my internship I could able to study surgery only that classes only. So in that November almost the AIIMS used to repeat emergency questions every time. Then May it was medical emergency questions, and November the questions were almost all emergencies was from surgical emergencies. Just because of that class, I could answer almost every question of that surgical emergency, and newer some questions on trauma, congress, which the sir taught us in the class. That question came. The most I like the surgery class the most in Bhatia. Then the pharma class, which was the first class in January, February. At that time I was in much serious, so I couldn't. Yes, sir. I couldn't entirely focus on the class. I made the notes, but later in my this time preparation, that note was very useful. The pharmacology, almost 200 pages notes were there in just 3 classes. But that was he taught us in a conceptual way pharmacology. The conventional learning was the guidebooks were very difficult to study pharmacology, but he taught us how to study, how to remember, how to approach pharmacology concept. The question we might think that excretion type of questions, which we may think it's a direct question. If we know, we can answer. If you don't know, we can just skip. But he made an approach like, if you don't know also, you just think about the class of the drugs, about the chapter. He taught us in such a way that we could at least think pharmacology question. We could think about a pharmacology question. Then
what about anatomy? How did you like it?
Anatomy, Ashwini, sir.
Dr. Ashwini.
Anatomy was also very nice. I had also attended another anatomy class, Dr. Rajesh Kaushal sir. But the combined approach was almost in just 3 TND classes were there. He could maximum he could cover. He covered in that 3 TND classes. Embryology class was very nice. Embryology question last May, lots of embryology questions were there. So I was expecting an embryology question this time also, but it didn't come. Zyada kuch nahi aaya. But he taught us embryology so nicely because embryology was a grey zone for almost everything.
I'm just glad that he covered all your concepts. After all, learning is another art of yours, right? See, I hope you learned a lot from this gentleman, a magician who scored, he got a rank 8 from rank 807. That's a magic overall. See, a very warm congratulations again. We are proud to call you a part of Team DBMCI. And here we have a thumbs up. Thumbs up, thumbs up, thumbs up. Work hard, play hard, and I'm sure the next person sitting beside me will be you. Thank you, Team DBMCI.